Are you under 65 but close enough to retirement and have built enough nest egg that you think you can get to and through retirement, but you're concerned about health care between, let's say, maybe age 60 and 65 when Medicare kicks in? Like, hey, I have enough to retire and get me through retirement, but I don't want to spend 20, 30 grand a year on health care between age 60 and 65. Well, if that's the case, then you are in the right spot today, because we have partnered with a firm called Move Health, and they work throughout the nation. I'm going to cover that a little bit more. I'm going to go through a case study. This is going to be a high-level video, short and sweet. There's going to be other videos out there that are long and way more detailed, but this is basically just an introduction to show you what is available out there for you. And of course, if you want something that's going to go down in the weeds for your particular situation, of course, reach out to us. We can hook you up with Move Health and do a full plan for you, obviously, for retirement, since that's our specialty. But a lot of times we have people come to us and they say, hey, Tim, I'm 59. I think we've got plenty of assets to retire. We're doing great. We're comfortable. We want to do a few things. We don't need to do anything outlandish. But hey, we don't want to spend 20, 30 grand a year on health insurance until we're 65, until Medicare kicks in. So anyway, let's just jump right in with Move Health. We're going to look at a few slides here that shows, a visual is always better, right? So first off, Move Health, of course, this is their first slide. It says, we exist to make healthcare coverage simple and clear. So that's great, right? Because our Medicare program is basically anything to do with our government tax-wise, or any program or subsidy or credit can be extremely confusing, right? So we're glad they're out there. We obviously, we've met them recently. We wish we had met them sooner because of the great stuff that they've been able to do and how they've been able to help people. So let's just go down here. First thing is the introduction. Hi, we're Move Health. I've got 60 plus years of experience between all of them. They have both pre-65 health insurance options, which is what we're going to talk about today, but they also help with Medicare coverage, and they can help you find the lowest cost each year for your Parts B and D premiums, which is great. And of course, they are, like I mentioned before, they are licensed throughout the country, and they are federally certified to assist with implementing any tax credits on the ACA marketplace, which is great. And also, they are not compensated by commissions, so they're probably going to generally recommend a supplemental plan as opposed to a Medicare Advantage plan, because the coverage is generally better for people that have a little better situation for retirement. But not always. Sometimes there's a lower percentage of time that the Medicare Advantage plan is going to be better all around. But anyway, they help with that with Medicare, and then obviously they're going to help with the ACA credits and the ARP credits, which is what we're here to talk about today. So let's jump right into a case study. Of course, when we start with this, my financial advisor says, hey, I can retire, but I don't know what to do for health insurance before I turn 65. Because I've ran into it before, even if people with means and they can afford it. Well, they're like, hey, Tim, I don't want to spend $26,000 a year on health insurance. I don't hate my job that much. I can work another few years. But let's take a look at what we can do with these credits. So, as with most things, a case study is the best thing to look at to illustrate. So here we have a 6-year-old couple, and they're ready to retire and, of course, spend more time with their grandchildren. But a lot of times in my situation, the grandchildren are a key aspect of what retirees want to focus on in retirement, which is perfect. So for the past 35 years, they've been covered by an employer plan, and now they're thinking that in retirement, they're going to be making about $85,000 a year, with pensions or maybe taking money out of a tax-deferred account. Another thing to consider here is a lot of times we can change around income each year based on what you actually have. If you have a large joint account, maybe we can drop your income or raise it, and that's going to make a big difference on how we can make sure that we're getting the best rate for you or the best credits for you for healthcare. We're also going to look out over the next 20, 30, 40 years of your retirement and see, hey, if we do this now and then at 65, maybe we can start doing some really good tax planning to lower your lifetime tax liability. So again, it's a comprehensive plan. Maybe we have a few years where we say, hey, we're gonna drop our income down for a few years until we get to 65, and then we're gonna start doing Roth conversions, so on and so forth, to lower that lifetime tax liability. Okay, so we have this case study here. Another thing to consider with this plan, and this is a big point, is that with these ACA and ARP credits, it does not matter what your net worth is. You can be a multimillionaire, and if you can keep your income low enough, you're still going to be able to maximize these credits. So remember that. That's a key point. You can have a few $1 million in your nest egg, but if you can keep your income lower, that's all it's based off of. They don't look at your net worth or your assets or anything. They're just going to say, hey, look, this was your income, so you can get these credits to help pay for your ACA plan. Now, this is how the advanced premium tax credits work. So first of all, you can't have an employer that's going to pay for your plan, obviously. And then the options that we have are going to be Medicare and Medicaid. We're going to focus on Medicare, right? And of course, these credits and premiums are going to be based off of your MAGI, or your modified adjusted gross income. All right, what is the American Rescue Plan? Most people know what the ACA is, the Affordable Care Act. But what is the American Rescue Plan? Well, it was one of the legislations passed during COVID-19 that affected a lot of stuff kind of under the radar. And the biggest thing I want you to remember with this is, obviously you can see this slide here, but it removed the income cap for ACA subsidies, and it made health insurance subsidies available to those even with over 400% of the federal poverty level. And of course, it also caps on the marketplace the percentage of your income is only 8.5% of what you could pay towards premium of your MAGI. So that's pretty good. And this is set to expire at the end of 2025. But even if it does, as I mentioned, we still have the Affordable Care Act. And if we can basically change things around to say, hey, we can lower incomes and make sure that we stay under this until 65 to get these credits, it can be a huge deal. And I'm about to show you how. All right, so again, here's the case study, 60-year-old couple, Dallas, Texas, and they have a modified adjusted gross income of $85,000. Well, if they do nothing and they don't try to get the credits, this is what they're going to pay. Bronze is a little over $17,000, silver is a little over $22,000 for annual premium, and the gold is almost $30,000 in annual premium. Let's say we work with Move Health and we apply some credits or get some credits that are available. Well, look what it does here. Even at $85,000 income in retirement, it's going to drop the bronze plans all the way down to a little over $1,600 a year. So that's a huge difference, right? The silver plan is just under $7,000 a year. So again, that's a lot more palatable than paying $22,000 a year for premiums, right? And the gold is going to still be the best plan, still going to be a little over $14,000, but huge difference. Now, let's say we can cut that $85,000 in annual income in half again to $42,500. Now, the reason for that is, like I said, maybe they had a joint account, or they waited to flip on a pension or whatever because they had other assets, and we were going to allow some other stuff to grow. Well, if we can do that, look at this. The bronze plan, you pay $0 for. And the silver plan, which is generally pretty good coverage, deductible drops to $3,800, and the annual premium drops to $692. So huge difference, right? And then the gold plan is going to be dropped all the way down to $8,000 per year in annual premium. Now, of course, if you run the numbers, and I think this might be off by a few bucks, but you can see the difference, right? That's over $21,000 of tax credits unlocked in 1 year of retirement. Well, if these guys retire at 60 and they're going to get to 65 before Medicare comes in, they're going to save over $108,000 by just making sure that we're using these tax credits correctly until they get to 65 and Medicare. This is a very big opportunity for people that are thinking about retiring early before 65. But of course, as Move Health says here, effective healthcare planning matters, right? If we can save somebody that wants to retire before they get to 65, we can save them over $100,000 in annual healthcare premiums. Do you think they're going to like that? Of course they are, and I'm going to feel great because we've helped them get to their retirement and be able to retire early without worrying about the crazy cost of our healthcare. So bottom line, this again was a high level view of what we can do for using the ACA and the ARP credits to make sure that we are lowering our healthcare costs before 65. And if you'd like to hear more, please reach out. We'd love to help you with this. If you've been self-employed for years, you want to retire, you want to make sure you have good coverage until you get to 65 because you think you've done well enough, reach out to us. We'd love to take you through all of it and make sure you're threading that needle correctly and most effectively and efficiently to maximize your retirement. Thank you, and I'll see you in the next video.
Once again, Tim Dorman here, founder of Eagle Ridge Wealth Advisors. And if you would like to see how we help our clients get the most out of their financial lives in retirement, please visit us at erwealth.com, and we hope to see you there.